our first case of a novel coronavirus confirmed in a person here in British Columbia.
Coronavirus. It's been on our minds for well over a year now. Sustainability is conceptualized in multiple dimensions, such as environmental, social, and economic. When it comes to climate change and sustainability, where are we now and where might we end up? Today I'm asking our faculty about our future after COVID.
In terms of thinking about sustainability and the work that I do, it might be surprising for people to know as a health services researcher that this is actually a concept that's important to me. Oftentimes we're thinking about things like planetary health when we think about sustainability or the environment, but health services and health systems are actually part of the everyday environment that we live our social lives within.
Greenhouse gas reduction is a global public good. It means it's a global collective action problem, and you need everybody acting. And that's really hard.
People with disabilities suddenly have found that their usual access routes have been blocked by cafes and other uses.
We don't resource the reduction of vulnerability. We resource reactions to devastation.
COVID has highlighted a lot of the vulnerabilities within our society. Valorie Crooks is a professor in a geography department who studies health geography and is a health services researcher. During this pandemic, she has been working to help map the vulnerabilities to COVID-19.
And in this project, we've been looking at using a vulnerability approach to understand neighborhoods that have greater risks to COVID-19 exposures relative to others across British Columbia based on a whole number of factors that we've factored in using a model that we've developed for this purpose. And I'll let you know, actually, we're working on some next steps in this project. So one of the steps that we're working on right now is actually looking at those risks of experiencing long-term health effects of the pandemic. So not people who develop COVID-19 and their symptoms, but actually many of us are going to have our health affected by the pandemic in one way or another, whether it has to do with changes in our household and employment context, changes in our everyday routines. All of these changes are bringing on various kinds of stress events. We're seeing some occurrence of depression being diagnosed. And so our team is working on modeling that, looking at a spatial approach, again, to develop maps that will be available for the public to look at and explore.
When you talk about kind of moving beyond COVID and like back to work, is this map kind of like a tool that'll help guide us through, I guess, like what policies are implemented?
So the sort of next stage of our project, it's going to be really relevant, especially to policymakers and healthcare administrators that are thinking about resource allocation to deal with the health effects of the pandemic at large. So in our work, we're identifying neighborhoods that experience a certain level of risk or vulnerability to these based on the activities that people undertake within them and also the profiles of who lives there, as well as in some cases the kind of places that exist within them. And so healthcare administrators are going to be able to look at these maps and use them as part of a decision-making tool complement. So the work that we've been working on with Dr. Sherman and I around COVID-19 and mapping, it's never been intended to be a single source of decision support for those that are making important public health decisions in this pandemic. It's meant to be a tool that can be consulted by those that are looking to gather all kinds of information to make informed decisions. And we're really delighted to be part of helping to contribute to that and to offer a geographic lens to this opportunity.
Medical tourism is the practice of traveling to another country in order to receive healthcare services. Do you think that's going to be like a thing, or is that already happening with people kind of traveling to get like COVID vaccines, for example?
For myself, as somebody who's been looking at the ethical and equity dimensions of medical tourism for over a decade, my stance is very clear, which is that vaccine tourism should not be viewed as a solution towards ending the COVID-19 pandemic in any way. There's a lot of ethical and equity challenges that relate to moving people across borders to consume medical resources or healthcare resources. So it introduces a number of very significant questions, even in relation to malpractice and travel health insurance coverage and the opportunities under which actually people's actions may be nullified as a result of this travel. There are other concerns that exist as well with regard to people actually accessing vaccines abroad that have yet to be approved in their home jurisdiction. Another concern that also exists is that not just with vaccination, but any time that you access medical care abroad, it can actually be really challenging to get that information as part of your medical record here in Canada. And so there's an additional challenge because in Canada, and not just Canada, but other countries around the world are building vaccine registries that are robust, that report all information with regard to vaccination among those within the country. And so when you're bringing that record in from abroad, will you receive the information that's needed? But overall, again, in terms of thinking about vaccine tourism as a solution to open up the tourism sector and tourism-dependent destinations, which are really the groups of countries that are very highly interested in opening this up. So for example, I see often discussions of this on the Caribbean news mentioned from a number of different countries, especially with the pending approval of a vaccine based in Cuba. But this is a short-term kind of band-aid solution type of approach to long-term systemic issues of not having enough diversification of economic activities in tourism-dependent destinations. So, again, with regard to thinking about vaccine tourism as an opportunity to open up the touristic sector, we have to really wonder how much of a contribution to the economy will be made by tourists, quote unquote, who are planning to come in, become vaccinated, likely to stay for relatively short periods of time and then return to their home countries.
We've heard a lot of concerns about mental health beyond COVID, and especially with the overdose crisis that's also been augmented by COVID.
Exactly. And in fact, here in British Columbia, this has been an existing crisis that predates the onset of the COVID-19 pandemic. Once again, Nadine and I are collaborating in this case with people based at the BC CDC. And we're at the early stages of trying to work with a group to develop an understanding of some of the ways in which the built environment actually can tell us really important information with regard to the overdose crisis and specifically where overdoses are occurring. Knowing this information actually can help us once again sort of concentrate our service allocation or resource allocation in order to help to better support what it is that's going on. Because as you were alluding to, this is a crisis, an absolute crisis in the province of BC that predates COVID-19 and will exist following the last person that receives a vaccine and the last identified COVID-19 case that's active in the province.